must know in a lecture. So we will cover all these things. Something about tuberculosis. Tuberculosis was a deadly disease, and if you consider and compare it with nowadays, you can say that as we have now last stage cancer or the last stage or clinically progressive this AIDS complex. Same was the situation was with tuberculosis. If somebody had diagnosis of tuberculosis, it meant death. There was no cure. Okay. Robert Koch was the first scientist who discovered Mycobacterium tuberculosis. And we have many contributions from this scientist in terms of microbiology. He gave cause postulate for the diseases. This is the most important slide for this lecture. Actually, I have summarized the whole lecture in this slide. And we will cover these points basically in our whole lecture. If you see, points to remember, very basic thing, tuberculosis is caused by which bacterium? Mycobacterium tuberculosis. This tuberculosis can affect many organs, but most common is pulmonary tuberculosis. So it is primarily a disease of lungs. As I will discuss, you will note that there are other types of tuberculosis also. It can affect other organs also. It spreads from person to person through the air. Through the air, for example, if somebody sneezes, coughs, then it can go and in the form of droplet nuclei, it can survive for some time, some hours, and in sputum it can survive for longer time. So these are the main source of infection. So most important point here is that it is transmitted from person to person through air. Most important clinical feature is chronic cough. If anybody has history of more than 2 to 3 weeks of cough, we should consider tuberculosis as one of the diagnoses. And if it is not relieved by common antibiotics, then you should think about tuberculosis because it is a very common disease, especially in the developing countries. But it is nowadays, you should consider it in every place because as I will tell you something more about, nowadays with this HIV, there is re-emergence of tuberculosis. Maybe 20 years back, we have controlled tuberculosis well with the anti-tubercular therapy. But as you know, with the HIV, many infections can happen, and we have the re-emergence of many diseases, which includes tuberculosis. So again, it is important in present context of infectious disease. Specimen for diagnosis is sputum. Why sputum? Because it is basically a lower respiratory tract infection. For any lower respiratory tract infection, the sample of choice or specimen of choice is sputum. If it is upper respiratory tract infection, you can take throat swab and other things. Acid fast bacilli staining by Seal-Nielsen culture. All these things I will tell you in detail. Culture is gold standard for diagnosis, for which we use commonly used media, Lowenstein-Janssen media, Algae media, and Middlebrooks media. Treatment of tuberculosis, HRZES, short form for isoniazid, rifampicin, ethambutol, streptomycin, and H is isoniazid, R rifampicin, E ethambutol, and what you have pyrazinamide and streptomycin. 5 drugs. These are the first line drugs for anti-tubercular therapy. Now we have, as I have told you, that we have got problem with tuberculosis. Now it has become important again, re-emerging disease. Why? Because we see it along with many other conditions, for example in diabetes patients, in HIV patients, and we have resistance to tuberculosis. This bacteria, Mycobacterium tuberculosis, has developed resistance to some of the mainline drugs, especially isoniazid and rifampicin. These are the 2 main drugs, and if any bacteria, Mycobacterium tuberculosis, has developed resistance to these antibiotics, then the term multi-drug resistant tuberculosis is used. Along with this, we have one more term, extensively drug resistant tuberculosis, in which along with these two drugs, to some of the second line drugs, it develops resistance. So it is very difficult to treat situation. We have very limited options if the person develops multi-drug resistant tuberculosis. And for prevention, we use BCG vaccine. BCG vaccine is basically derived from Mycobacterium bovis bacilli calmette urine. Is the term. It is given at birth. And if you see, there is a mark on our left side here in this area, and this is basically BCG vaccine. This classification, just you remember that there are different types of Mycobacterium. Mycobacterium tuberculosis is one of the type, and it is exclusively for human beings. There are other types which cause infection in animals also. Some types which cause opportunistic infection. Some are saprophytic, means they don't cause infection. So we will not go into the details of this. Now Mycobacterium tuberculosis, if you see, they are straight or slightly curved rods. Now most of the bacteria we divide into two types, gram positive and gram negative. But this Mycobacterium, and there are some more bacteria as I will discuss. Yes, we don't divide them into gram positive and negative because they are not strictly gram positive or negative. Their cell wall is somewhat different. So the cell wall also, I will tell you, it has got more lipids. It has got one thing, mycolic acid, which is basically a type of lipid. And if you see, this is because this point is very important in terms of Mycobacterium tuberculosis. If you have seen a candle, so candle has a waxy, it is basically wax. So same type of waxy structure is there in the cell wall of Mycobacterium tuberculosis. So what happens, what is the term? Acid fast means, and alcohol fast. Fast here means to fasten something or ability to hold anything. So these bacteria, this bacteria is able to hold the dye or color of the dye that we have used for staining. Even when we put alcohol or acid over it, it will retain the color. Any other bacteria cannot retain it. Why? Because it has got this waxy layer which contains mycolic acid. So it is non-motile, non-spore forming, non-capsulated, obligate aerobic, cannot survive without oxygen.
That's why it goes to the lung.
Yes, and lung is the main site. Optimum temperature for most of the human pathogenic bacteria, it is 37 degrees centigrade, the body temperature. Optimum pH 6.47, slow growth. Generation time 14 to 15 hours. This time is also very important. Generation time, because this is very long. If you see, for common bacteria like Escherichia coli, E. coli, it is only 20 minutes. That is, in 20 minutes from 1 to Escherichia coli will form. But here it is 14 to 15 hours. So it takes very long time for Mycobacterium tuberculosis to grow on culture media.
So that's why we have to wait till we get the result from the lab.
Yes, exactly. This point will explain the culture method. Grows well on enriched media containing serum. So only important point. This thing actually I have explained to you already. The cell wall of Mycobacterium tuberculosis. In this, if you forget everything, just remember it contains mycolic acid, which is a fatty, basically lipid containing part. It accounts for 60% of cell wall weight. So this acid fastness, if you see the last point, responsible for many characteristics. Acid fastness, mycolic acid is resistant to common laboratory stains. Once stained, cannot be decolorized with acid solution. This is the key point, because we make the diagnosis of this infection tuberculosis mainly with acid fast staining. Even after so many years, we don't have many better methods for diagnosis. So remember mycolic acid. Here also in this picture, the different layers are shown. This picture is, before I proceed further, for both the lectures, you will have questions on this written questions, MCQ type, and you will have questions of OSPE also. some questions of OSP will come from these lectures. So all the pictures are important. F at as mycolic acid. So no need to go into detail. This is actually not very important. The important point in this is that it contains mycolic acid, which is different from all other bacterial forms, and that is why it has got a unique property of acid fast bacilli, that it is acid fast. There are other bacteria also, some very few bacteria which are acid fast, which includes all the types of Mycobacteria. They are mostly acid fast. And we have some more bacteria. For example, we have some organisms like Nocardia is also acid fast. Bacterial spores are also acid fast, but it is easier to differentiate because most common bacteria, they are not acid fast. Now some more points. Resistance of Mycobacterium tuberculosis. If you see, they remain viable in droplet nuclei for 8 to 10 days. Droplet nuclei, something, for example, if somebody sneezes and it forms an aerosolic structure which can settle at different places, droplet, it contains the bacteria. So it can survive for around 8 to 10 days. So it is actually dangerous. Remain viable in sputum for 20 to 30 hours. So any patient who is having tuberculosis, his sputum is also very dangerous for 1 day. Cultures remain viable, and we have different sensitivities for this. So first 2 points are very important, as you can see that if you see these 2 points, these are the main source of infection for other human beings. These are the common source of infection. For example, if somebody is having tuberculosis, he sneezes, he coughs, he has chronic cough. So always he is doing coughing. So these droplet nuclei will be around him in his room. So anybody who is exposed to this can also get tuberculosis. This is the pathogenesis part. This must, you had tuberculosis lecture on? Yes. So I will not go into the details of this, and this you can actually ignore in microbiology lecture. There will be no question with this. You can see. One thing that I want to point out in this, that everybody who has tuberculosis or is exposed to Mycobacterium tuberculosis does not develop the disease. It depends on how many bacteria he has taken and what was the patient's defenses. Defenses mean immunity in general. For example, if you see, if this part is immunity, in this part, it is touch screen.
Smart.
Yes, I forgot. So if you see in this part, the immunity is very good for this patient. And if the number of bacteria that he has taken inside is small, then it is very unlikely that he will develop the disease. Yes. And when the immunity is going down and the number of bacteria are increasing, then the probability of disease is increasing. So it is simple actually. This all must be dealt. This has been dealt that it is inside macrophage, it remains inside macrophage. Okay. Now coming to epidemiology, it is a very common disease, or it is very common actually, this tuberculosis. Not as a disease but as an infection. 1/3 of the world's population is infected. So you understand the difference between infection and disease. Infection is they have been exposed and tuberculosis has gone, Mycobacterium tuberculosis has gone inside their body.
But they don't have the TB disease.
Most of them will not develop tuberculosis. Most common in Southeast Asia, Africa, Eastern Europe. 9 million new cases of active tuberculosis per year. So you can imagine the burden of disease. 9 million, 2 million deaths per year. Source of infection is only human, that is from human to human transfer. And if you see greatest risk of disease in people who in any way are immunocompromised. For example, immunodeficient due to HIV, drug or alcohol abusers, homeless people, prisoners, individuals exposed to diseased patient. In some of the categories, if you see prisoners or people who remain in close contact with other people. So if anybody is living, for example, in a close place along with other people and one person develops the disease, then there are chances that other people will also develop. Humans are the only natural reservoir, person to person spread by infectious aerosols. However, if somebody asks you that how tuberculosis spreads, then it is by air through person to person. But we have the cases of tuberculosis due to milk products also. Theoretically and actually, we can have tuberculosis due to ingestion of.
Not out of Mycobacterium tuberculosis. Out of Mycobacterium other.
Rare. Theoretically, it is possible.
But the human is the only reservoir. How could it get through the milk?
No. I am telling that theoretically, for example, if food is infected with the droplet nuclei and somebody eats it, like that. So theoretically, but just forget this thing. Only thing is that it spreads through air from person to person. Primary infection is pulmonary infection, post-primary. The difference here is that if you see clinically, the main difference, in primary initial infection, the lower and middle lung fields are affected and it is controlled. In most of the people, it will be controlled infection. That is, infection will not spread. However, in post-primary or adult type, apex of the lung is affected. So if you find any radiological finding that the apex of lung is affected, then you should think about tuberculosis. So anything can be affected, but apex of lung basically is indicative of post-primary adult type infection. Now if you see, this infection can spread to various parts of the body. If you see the last thing, metastatic infection, tuberculous meningitis can go to the meninges,
The brain.
yes, and cause tuberculous meningitis. It can spread to bone and joint. It can cause this renal tuberculosis, kidney. What?
And if it goes to the vertebra, it causes Pott's disease, right?
Which disease?
Pott's.
In which part?
Then there's Pott's disease, which is it causes.
Cause, yes. Cause vertebra. We use the term for that. So that is actually spinal tuberculosis. Yes. So we use this term. This is part of bone and joint tuberculosis. So we have this, and kidney, renal tuberculosis, uterus and testes also. In uterus also it is very common. If you see in many female patients who are having infertility, when you are investigating them, you should think in terms of this endometrial tuberculosis also. That is an important cause of infertility in females. Clinical features. If you how we make the diagnosis. First thing is clinical features. Clinical features, the person will have history of at least 2 to 3 weeks of chronic cough with low grade fever and weight loss. These are the 3 important clinical features for tuberculosis. So if he is giving history of weight loss, you should think about either carcinoma in general, HIV AIDS also you can think, and tuberculosis. These are the 3 important differential for history of weight loss. Carcinoma can be many types. So he will have chronic cough, low grade fever, not high grade fever, and weight loss. Radiographic evidence of calcification in lungs you can have. We use different types of method that I will discuss in detail. Bacteriological investigations, molecular methods, serological diagnosis is not important. So just quickly we will go through this. Bacteriological investigation, sputum is the sample of choice. Ideally you should take 3 samples for any patient. 3 samples, and it depends on where the patient is. Spot, if you see specimen collection, outpatient means person who is coming to OP, you take the sample for the first time when he comes to the OP. That sample is known as spot sample. Spot means he is coming at the spot, you are taking the sputum sample. Second day again you take early morning sample. So mainly we take this new recommendation is that we take only 2 samples for outpatients. For inpatients, as he is admitted to the hospital, you can take 3 early morning samples over 3 consecutive days. You should be able to take a sputum sample. There is a difference in sputum and salivary sample. That is very important for diagnosis because saliva is from mouth, sputum is coming from inside. So only sputum sample should be taken. These pictures are important. Yes, all the pictures except for that cell wall are important. Just concentrate, you can solve all the questions for OSPE with this. Staining method, we have many types of staining method for this. Acid fast staining is the general term which is used. We have Zeal-Nielsen method. In Zeal-Nielsen method, we used heat for staining. There are other methods like Quinon's method in which we don't use heat. So what happens? Basically, as I have told you already, it has a different cell wall. We use some dye and we use acid, very basic thing. And then we stain, then we see it under the microscope. So if you see these pink colored small structures, you can see small structures rod like. These are the acid fast bacilli, typical acid fast bacilli suggestive of Mycobacterium tuberculosis. For any such picture or any bacteria, you cannot say that this is this bacteria. We need to confirm it. We can say that this is most probably Mycobacterium tuberculosis. We have other methods also in which we use fluorescent dyes. If you see the small structures, greenish, these are the fluorescent structures suggestive of Mycobacterium tuberculosis. And we have this method for recording the sputum smear microscopy results. Just I will leave it. Culture is the gold standard for tuberculosis diagnosis because if you see the positivity rate of sputum smear is very less. It is less than 33%. So many
you might not find the bacteria.
Out of 100 cases, you may be able to detect positive cases only in 25 cases. He is having tuberculosis. So you cannot diagnose it. So we need culture. For culture, just remember that these 2 common media, Lowenstein-Jansen media and Middlebrooks media. There are many more, but these are the commonly used media. Now problem, as if you remember, yes, 14 to 15 hours for generation. So it has got slow growth. 2 to 8 weeks to get a culture positive. Even if it is there, it will take 2 to 8 weeks.
We have to start empirical therapy before that, right?
It actually depends if the what is the condition of patient, and we also take the help of chest X-ray. If on chest X-ray, it is likely that he is having tuberculosis, then
we start empirical therapy.
Yes, in many cases. Even with culture, some cases who have tuberculosis will not be diagnosed. Culture will come negative because it has also got limitation.
How to diagnose if the culture is negative?
Yes, I will tell you. So we have different types of colonies that grow. This is the picture of Lowenstein-Jansen media which is used for diagnosis. And if you see the term breadcrumb-like growth, and you can see the picture of colony. We use the term for this type of feature of this colony characteristic of Mycobacterium tuberculosis, rough, tough and buff colonies. Rough, as you can see in picture, they look rough. Tough means they are difficult to remove, and buff is buff color. Buff is actually a difficult color to define, something creamish or like that. So we have this rough, tough and buff colonies. In this, all types of Mycobacterium can grow except for Mycobacterium leprae. Mycobacterium leprae does not grow in any culture. So we have different types of Mycobacteria, if we get the growth in less than 3 days, this means that these are the rapid growers. And if we get the in 3 to 8 weeks, then they are slow growers. What are these rapid growers and slow grower? I will tell you at the end. And we have different other methods. We use liquid media also, a type of Middlebrook media. And we have many methods of recent methods for diagnosis of Mycobacterium tuberculosis. There is no time to go into the details. For example, Mycobacterium growth indicator tube. But I will tell you the principles for this. It is easy to understand actually. We have the culture in a tube and we detect some changes in air pressure or changes in oxygen or changes in carbon dioxide for all these methods. For example, in MGIT, Mycobacterial growth indicator tube, we see if the oxygen is used by this Mycobacterium, then a fluorescent compound will fluoresce and we can detect. Bactec 460 is a very commonly used method because it gives the results in lesser time. It can give the result in 12 days. If you compare it with 2 to 8 weeks, it is very less. The basic thing is here is that we use a radioisotope, carbon 14 for this. And we have some more methods. For example, a type of MGIT. In this also we can process up to 960 samples. Mycobacteriophage based assay. Mycobacteriophage means virus which can affect Mycobacterium. So we see the growth and formation of plaques on the growth plate to assess this. Rapid slide culture also we can do. And in this, if there is cord formation, it indicates a virulent strain of Mycobacterium tuberculosis. This cord-like structure will be seen on slide culture. And we have some other ESP culture system and luciferase reporter, etc. After that, you have got the growth or this in culture that this looks like Mycobacterium tuberculosis. You need to confirm it. For that, we do biochemical tests. For biochemical test, niacin test is very important. If you have got niacin test positive, this is a there is a high probability that this is Mycobacterium tuberculosis. And there are other tests also. You don't need to remember any at this stage. And we have molecular methods for diagnosis now, and mostly they are based on the amplification method.
Like PCR.
Yes, like PCR, lamp loop mediated isothermal application, line probe assay, etc. This line probe assay we can directly use on sample also. So we have these things. Serological diagnosis. Serological means through blood. It is up till now we don't have any good test for diagnosis of tuberculosis. So serological tests are not useful in diagnosis for tuberculosis. And we have some newer methods, in vitro, interferon, gamma release assays, etc. Tuberculin skin test, Montoux test. This is important. In this we use purified protein derivative from the cell wall, and it is injected intradermally into the forearm. And what we do, we see the induration. Induration means there is at the skin, a part of skin will be raised, and if it is more than 10 millimeter, then it indicates positive result. There are two things, one is redness, one is induration. A larger part may be red, but we only measure the smaller part which is raised up. So we measure only induration. Remember this point. And this is the caliper with which we use. If it is more than 10 millimeter, it indicates positive results, and we measure it after 72 hours. And what does this indicate? Actually, it can show many things. Basically, it indicates the exposure to tuberculosis, that the person has been exposed to tuberculosis before or not. Treatment, prophylaxis. BCG vaccine, Bacilli calmette guerin, derived from the Mycobacterium bovis, given at birth. So this I have told you already. Atypical mycobacteria. There are other types of mycobacteria also besides Mycobacterium tuberculosis, and sometimes we use the term MOT, Mycobacterium other than tuberculosis, non-tuberculous mycobacteria, atypical mycobacteria. All these terms are used interchangeably. There was one scientist, Ronians, he classified in 1959 these mycobacteria into 4 types. One is rapid growers that grow fast in less than 7 days, and besides that 3 more types: photochromogens, scotochromogens, and non-photochromogens. Photochromogens produce pigment in light, scotochromogens pigment in light as well as in the dark, and non-photochromogens does not produce any pigment. So that's all. So just remember, only things that I have discussed are important. You can tell other students also. Quickly we will go through this also.